topic of presentation is herbal alternative to diabetic amputation.
We are presenting our project, a herbal remedy for diabetic amputation. Introduction. Diabetics mean diabetes, a chronic lifestyle disease. Diabetic patient prone to many food problems, mainly after 10 years, due to two reasons. Ischemia, that is poor blood circulation. Neuropathy is damaged nerve system. Neuropathy causes losses of sensation. Ischemia causes reduction of ability to heal. Even a tiny cut in the feet. Result, food ulcers leading to amputation. International Diabetic Federation survey 2005, 50 to 70% amputation is related to diabetes. Every 30 seconds, one leg is amputated. Even after amputation, the wound ulcer may appear in another limb, causes secondary amputation. Spending trillions of dollars in medical research in diabetic healthcare, but incidence of diabetes and complications have increased. Materials used. Some medicines give temporary cure, but the ulcer repeats. In this situation, our herbal combination called dia-herbal means help for diabetic patients, gives permanent cure, contain extracts of 20 medicinal plants, Cucuma longa, Centilla asiatica, aloe vera, Punica granatum, Momodica charentia, Syngium cumini, and a group of 3 plants called Trifila and group of 10 plants called Dashapushpa. Methodology. All these herbs proportionally prepared and incubated at 70 degrees Celsius for 2 hours. This extract concentrate is diluted with 5 minutes volume of sterilized water and mixed thoroughly in a rotary shaker 4500 rpm for 5 minutes, whom we give treatment. Diabetic patient at the extreme stage of food ulcer and the amputation of the limb or toe is prescribed by medical practitioners. Diagrammatic representation. Different category of diabetic patients that we are treating. Pre-amputation stage 14%, amputation stage 38%, post-amputation stage 26%, and blood circulatory problem 22%. Duration of curing food ulcers. The food ulcers may 50% cure within 30 days. After that the curing is decreased. For 60 days, 60%, 120 days, 80%, and 180 days, even almost cure. The clinical parameters like glucose, urea, and creatinine. Up the beginning to 90 days, the clinical parameters like glucose, urea, and creatinine is gradually reducing to the normal. Treatment package. First, we are giving the counseling and guidance for the patient and their family members for building up of confidence. Then simple exercise including more pranayama and some massage like that. Then special diet including more leafy vegetables, vegetable soups, nuts, fruits, sprouts, etc. Intake of our herbal combination dosage depends upon the patient's health condition and the stages of the disease. Case studies first. The first photo is the stages of a curing from a dry grain of diabetic food. The first photo, not the blackened portion. The damaged tissues were removed 3 times by surgery. The next stages will be the affected portion is amputated. But that patient came to our treatment after 45 days. The living tissues developed, showing bleeding, the circulation restart. After 90 days, almost healed and retained the original color. The fourth photo, even after 3 years of cure, without any secondary infection and can live a quality life. Case study second. Different stages of curing a patient who were prescribed for amputation. After 10 days, most of the dead tissues ejected and angiogenesis started. The second photo, after 45 days, the wound fully filled with the new flesh. The third photo, after 180 days, that patient escaped from the amputation and that patient can live a healthy life. The fourth photo, even after 4 years, without any secondary infection and showing that patient's wound the wound is going to cure to cure. Case study third. The status of healing foot ulcer of a paralyzed patient to whom amputation of the limb and dialysis was prescribed. And also that patient's glucose level was 575 without giving any food. The second photo, after 1 week, healing of the wound initiated. The third photo, after 150 days, the wound healed and newly developed skin covered the wound. The fourth photo, the wound with completely healed and escaped from dialysis and amputation. Case study 4. A patient whose left leg was amputated above the knee and was advised amputation of the other limb because 95% blocked in the Doppler test. But in the second photo, the damage of big toe. In the third photo, the damaged big toe was removed, wound healing, and the wound healing started with regenerated tissues growing around the wound. The fourth photo, after 2 years of cure without any secondary infection. In the first photo, that patient's left leg, right leg, what happened is that leg is 95% blocked. Then if the big toe is removed, in medical science, that wound can be cured. So that they prescribe for amputation. Prevention of amputations. Signs. Our treatment package helps to blood purification and removal of blockage so that it enhances blood circulation, replacement of dead tissues and development of new blood vessels called angiogenesis. Through this process, patient gets good sensation and health. This way we can prevent amputation. Advantages: high success rate and less expensive. Permanent cure without secondary infection. Any side effects were reported. Conclusion: the plants used in the preparation of dia-herbals reported to have anti-diabetic, antioxidant, angiogenesis, anti-inflammatory, and wound healing effect. The effectiveness of dia-herbals combination is due to synergistic effect of the various compounds contained in the plant extract. In that way, we can attain our mission, avoid diabetic amputation and make a quality life for diabetic patients. Thank you very much.